Hello and welcome to my free VA Medicare Headstart series. I'm Christopher Duncan, and I know you don't care about who I am, but it's important you know a little bit about me because it's difficult to know who you should trust when you find individuals like me on the internet. I'm a certified Medicare insurance planner and a retirement income certified professional. What that means is that it is my business to study and keep up to date with everything that is Medicare and retirement. And I particularly like helping and giving my knowledge to veterans because of the sacrifices they have made for me, my family, and our nation. You should also know that all of my services are entirely free to you. I never charge a dime for my service. My grandfather was a World War II veteran that served in the South Pacific. He has an interesting story that he used to tell me about a run-in that he had with MacArthur, but that's for another time. And my father, now he is a veteran as well, and he is a Vietnam-era veteran. And for clarity, I get asked this. I am not a veteran. I did earn a degree in history from the University of Nevada, Las Vegas, way back before the last turn of the century. I studied mainly U.S. history from the early 20th century through the Cold War. I like to think because of my knowledge of this era, I have a small grasp of the sacrifices these generations made to provide me the opportunities that I have. Now, what I talk about in my series are strategies that I help my dad with to maximize the benefits he has earned because of the sacrifices he has made with his service and the taxes he has paid. I produce many videos and articles that are posted throughout the web. My work has been featured in publications like ABC, NBC, CBS, Fox, Forbes, and Forbes is one that I'm particularly proud of because it's tough to get featured in Forbes, WebMD, and Insure.com. Okay, enough about me and enough about the intro. Let's get to why you are here. In this video, we'll be going over Medicare Part A and B. Medicare A and B are also known as Original Medicare because these are the two original parts that started in 1965. There is also Medicare Part C and D, and I will cover those parts in subsequent video. But here we are, briefly focusing on A and B. I will not be going in depth into these parts because that can literally take hours. What I want to touch on here is what you need to know so you have a good basic understanding of Medicare. Okay, I'll jump right in here and we're going to start with Medicare Part A. The first thing to know is Medicare Part A has a $0 monthly premium. It is free, so to speak, because we paid Social Security taxes for 10 years or more. So you don't have to worry about paying a monthly premium for Medicare Part A. Medicare Part A is called hospital insurance, also referred to as inpatient insurance. Here is what Part A covers. Part A hospital insurance helps cover inpatient care in the hospital, inpatient care in a skilled nursing facility, and that's not custodial or long-term care. It also covers hospice care and home health care. As we know, Medicare doesn't pay 100% of the bill. When one has Medicare Part A and obtains services, there are deductibles and copays and coinsurance they are responsible for. Next, I'll talk about Medicare Part B, and this is where a lot of veterans ask, Chris, do I really need Part B and pay that monthly premium? My answer is, in years past, maybe it didn't make a lot of sense, but now there are programs that can pay up to all of the Part B premiums for you and provide additional benefits. Also, by putting your Part B in effect when the government says that you're supposed to, you avoid any penalties down the road. You will hear the old timers rail against signing up for Part B when veterans already have VA health coverage. But when they became Medicare eligible, these programs, they weren't available. But I'll get into those programs in one of our next videos. Let's get back to Part B of Medicare. Part B is called medical insurance, also referred to as your outpatient insurance. There is a slew of things this covers, but in general, covers our doctor visits, preventive care, lab work, diagnostic testing like MRIs, CAT scans, and more. There are almost 30 pages in the Medicare and You handbook about this. I could go on forever. But a good way to think about it is that it will cover you for going into a building and coming home the same day. Now, this isn't 100% accurate because it will cover tests and doctor visits while an inpatient in the hospital, but in general, if you're an outpatient, Part B will cover it. And Part B has a monthly premium. And in 2023, the monthly standard premium is $164.90 a month. And don't panic over this if you're a veteran with VA or TRICARE coverage. There are Medicare plans available in almost all parts of the country that can pay up to your full Part B premium on your behalf and provide extra benefits like dental, flex cards, over-the-counter pharmacy benefits, and much more. These plans come with a $0 monthly premium. If you get one of these plans with a Part B monthly rebate, they literally pay you for being on the plan. These plans don't change your VA medical coverage in any way. My dad has one of these plans, and I'll talk more about these plans in a subsequent video. That is the video here for Original Medicare. The key takeaways are Medicare Part A is inpatient coverage and has a $0 monthly premium. Part B is outpatient coverage and has a standard monthly premium of $164.90 a month. And there are programs available in almost all areas of the country that can pay at least a portion of the Part B premium for you and provide additional benefits without changing your VA medical coverage. And depending on where you are watching this video, you should see a button that will take you to the next video in my VA Medicare Headstart series. If you are ready, you can contact me and we can discuss your exact situation to ensure everything gets put on the right path. We will also discuss all of the different Medicare plans that are available in your area. And I'm an independent broker, and that means I get to represent many different companies like Humana, United Healthcare, Cigna, Aetna, Anthem, Blue Cross Blue Shield, and many others, all at the same time. And because the insurance companies don't employ me, they can't influence any of the companies or plan options that I present to you. When you contact me, we talk about what your exact needs are. And together, we look at the different options to find the plan that is best for you. If you're ready to learn more, the best way to contact me is at 888-960-VETS. That's 888-960-8387. Or you can set an appointment with me through my online appointment calendar. Thanks for watching, and I'll see you in the next video.